Laminar flow, a fundamental concept in fluid dynamics, refers to the streamlined, orderly movement of a fluid in parallel layers with no disruption between them. This type of flow is characterized by smooth, constant motion as opposed to turbulent flow, which is chaotic and irregular. The importance of laminar flow is evident in various natural and technological contexts, with one of the most significant being its role in the human respiratory system, particularly within the lungs. This video covers the medical definition and provides a brief overview of this topic. So if you're ready, let's get into it. In the lungs, air travels through a network of increasingly smaller airways, eventually reaching the alveoli, where gas exchange occurs. The design of the respiratory tract is such that it facilitates laminar flow, especially in the smaller airways and alveoli. This is crucial for efficient gas exchange and optimal respiratory functions. Laminar flow in the lungs ensures that air is delivered to the alveoli in a steady, uninterrupted stream. The primary function of the lungs is to facilitate the exchange of oxygen and carbon dioxide between the blood and the external environment. Laminar flow helps maintain a consistent concentration gradient of gases across the alveolar membrane, optimizing the diffusion process. Laminar flow offers less resistance than turbulent flow. In the lungs, this translates to easier breathing, as air moves more freely through the airways. This is particularly important for people with respiratory conditions, where maintaining laminar flow can help reduce the work of breathing. Laminar flow helps in the uniform distribution of inhaled air across the various parts of the lungs. This uniformity is essential for ensuring that all areas of the lungs are adequately ventilated and participate in gas exchange. Furthermore, the respiratory system also has a defense mechanism against inhaled particles like dust or microbes. The Mucociliary Escalator, a system of mucus and cilia in the respiratory tract, works more effectively under conditions of laminar flow, helping to trap and remove foreign particles from the lungs. In contrast, turbulent flow, which is characterized by eddies and irregularities, can disrupt these processes. It can lead to uneven distribution of air in the lungs, increased resistance, and impaired gas exchange. Turbulent flow can occur under certain conditions, such as high airflow rates during vigorous exercise or in pathological states like asthma or COPD, where airway narrowing and obstruction promote turbulence. Understanding the principles of laminar flow in the respiratory system has important clinical implications. It informs the design of respiratory therapies and devices, such as inhalators and ventilators, ensuring that they deliver air and medications effectively to the lungs. Additionally, it aids in the development of strategies to manage and treat respiratory conditions that disrupt normal airflow dynamics. So as you can see, laminar flow in the lungs is vital for efficient respiratory function. It ensures smooth and uniform air delivery to the alveoli, facilitates optimal gas exchange, reduces breathing resistance, and supports the lungs' natural defense mechanisms. Disruption of laminar flow leading to turbulent flow can have significant consequences for respiratory health and is a key factor in many pulmonary diseases. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.